How are optic neuritis and multiple sclerosis, MIS, connected? Imagine a sudden flash of pain and vision loss in one eye that comes on quickly. This is often how optic neuritis begins. It is an inflammation of the optic nerve, which carries visual information from the eye to the brain. This inflammation damages the myelin sheath, the protective covering around nerve fibers, disrupting normal signal transmission. Optic neuritis is strongly linked to multiple sclerosis, a chronic disease where the immune system mistakenly attacks the central nervous system. In multiple sclerosis, immune cells target the myelin in the brain and spinal cord, leading to inflammation, demyelination, and nerve damage. Since the optic nerve is part of the central nervous system, it is also affected by this autoimmune process. Research shows that optic neuritis is often an early sign of multiple sclerosis. About 1 in 4 people with MIS experience optic neuritis as their first symptom. Conversely, nearly half of all people diagnosed with MIS will have at least one episode of optic neuritis during their illness. The common feature in both conditions is inflammation that damages the myelin, impairing nerve function and causing visual problems. The risk of developing MIS after an episode of optic neuritis depends on what brain scans reveal. If magnetic resonance imaging scans show lesions or spots indicating demyelination in the brain, the chance of progressing to MIS within 15 years is around 70%. Without these lesions, the risk drops to about 25%. Most cases of MIS that develop after optic neuritis do so within the first 5 to 10 years. From an eye health perspective, optic neuritis can lead to lasting visual issues if nerve fibers are severely damaged. The inflammation causes symptoms like blurred vision, loss of color perception, and pain when moving the eye. Many patients recover most or all of their vision, but some may experience permanent damage, especially if the disease continues to damage nerve fibers. Understanding the connection between optic neuritis and multiple sclerosis helps doctors identify early signs of MIS. Studying how the optic nerve is affected provides insights into the broader disease process, including inflammation, demyelination, and nerve injury. This knowledge guides treatments aimed at reducing inflammation and protecting nerve fibers, which can help preserve vision and neurological function. Clinically, optic neuritis in MIS usually affects one eye and develops over hours or days. It is important to differentiate it from other causes of vision loss, such as ischemic optic neuropathy or medication side effects. Diagnosis involves a careful examination, MRI scans, visual evoked potentials, and sometimes analysis of cerebrospinal fluid to check for signs of central nervous system involvement. In summary, optic neuritis and multiple sclerosis are closely connected through immune system attacks on myelin in the central nervous system. Optic neuritis often appears early in MIS and serves as a warning sign for the disease. Recognizing this link allows for earlier diagnosis and treatment, which can help protect both vision and overall neurological health. If you experience sudden vision changes or eye pain, it is essential to consult a healthcare professional for proper evaluation and care.